Good morning, friends. Let's learn about zinc today. Myself, Dr.S.PONNE, Associate Professor from Department of Foods and Nutrition, Vellalar College for Women, Erode. Zinc is an important trace mineral. It is essential component of our body. Total body content of zinc is about 2 grams. The prostate gland is very rich in zinc, about 100 milligrams per gram. Zinc is mainly an intracellular element. About 60% of zinc is present in muscle and 30% is present in bone. It is also present in liver, brain, and skin. Zinc is present in most of our daily foods what we consume. Very good source of zinc is present in red meat, seafoods like oysters and mollusks. Good sources include poultry, pork, and dairy products. Whole grains, especially bran and germ, and vegetables include good sources of zinc. Poor sources are fruits and refined cereals. These are some of the foods which are rich in zinc: cereals, wheat germ, sesame seeds, pumpkin seeds, meat, shellfish, squash seeds, fruits, vegetables, spinach, mushroom, dark chocolate, and nuts. These are the recommended allowances of zinc. Adults require 15 milligrams of zinc daily, children require 10 milligrams. Pregnant women require 15 milligrams to 20 milligrams of zinc daily. From 0 to 6 months, the requirements are same for male and females. It is only 2 milligrams. From 7 months onwards and up to 3 years, the requirement is 3 milligrams for both male and female children. It is 5 milligrams for children between 4 to 8 years, and for 9 to 13-year-old children it is 8 milligrams, and for 14 to 18 years it is 12 milligrams for male and 13 milligrams for female. For 19 and plus years, the requirements of zinc is 11 milligrams for male and 12 milligrams for female. Coming to the role of zinc in human body. Zinc is regarded as an antioxidant. SOD. SOD is nothing but superoxide dismutase. It is an enzyme which is rich in zinc which protects the body against free radical damage. Storage and secretion of zinc from beta cells of pancreas requires zinc. Zinc is mainly necessary for maintaining the normal levels of vitamin A. It is also required for the synthesis of RBP, that is nothing but the retinol binding protein. Zinc is important for wound healing process. It is necessary for growth and division of cells. Zinc stabilizes the membrane structure. Gustin, a zinc containing compound present in saliva, is important for taste sensation. So, whenever we suffer from zinc deficiency, the taste sensation decreases. Zinc stabilizes the structure of protein and nucleic acids, and it is also essential for proper reproduction. There are about nearly 200 enzymes which are containing zinc, and some of which are very significant in our body. Alcoholic dehydrogenase is needed for the conversion of alcohols into aldehyde. For example, retinol into retinal. Alkaline phosphatase hydrolyzes monoesters of phosphates from various compounds. That is also a zinc containing enzyme. Carbonic anhydrase is also a zinc containing enzyme which is essential for respiration, allowing rapid disposal of carbon dioxide. Superoxide dismutase SOD catalyzes the removal of superoxide radicals which prevents free radical damage in our body. DNA polymerase is necessary for conversion of thymine, the pyrimidine unique to DNA. Carboxypeptidase is needed for the digestion of proteins, and delta amino levulonic acid synthase is involved in heme synthesis is also zinc dependent. Zinc is essential for maintenance of protein structure and for metabolism of proteins and nucleic acid. The maintenance and replication of genetic material and the use of genetic information to generate specific proteins are dependent on zinc. Zinc is involved in cholesterol transport, and it is also important in maintaining the stability of lipids within the cell membrane. Zinc dependent enzymes are involved in the synthesis of long chain fatty acids and various prostaglandins. Coming to the deficiency of zinc, zinc causes main various types of impact in our body. Zinc deficiency is mainly due to low intake of zinc in the diet, And also, zinc binds with certain compounds like phytates and fiber, and which is made unavailable for absorption. Iron and copper will compete with zinc for absorption. And various malabsorption syndromes also will affect zinc absorption. Burns, chronic renal disease, acrodermatitis enteropathica, Crohn's disease, cystic fibrosis, total parenteral nutrition. Subjects who rely on total parenteral nutrition for a longer period become zinc deficient. And also liver disease and alcoholism also deplete zinc in our body. These are the impact of zinc deficiency. Zinc deficiency may lead to diarrhea, skin disorders, hair loss, poor growth, behavioral anomaly, vision impairment, and so on. Zinc deficiency can be categorized into mild, moderate, and severe based on the symptoms. Mild deficiency leads to depressed immunity, impaired taste and smell, onset of night blindness, decreased spermatogenesis. Moderate zinc deficiency causes growth retardation and delayed puberty in adolescents, hypogonadism in males, rough skin, poor appetite, mental lethargy, delayed wound healing, and night blindness. Severe zinc deficiency causes severe immune suppression, frequent infection, bulbous pustular dermatitis, diarrhea, and alopecia, that is, loss of hair. Acrodermatitis enteropathica, it is an inherited partial defect in intestinal zinc absorption. It encodes a protein that appears to be involved in zinc transportation. Erythematous and vasculobulbous dermatitis are the impact of acrodermatitis enteropathica. Alopecia, ophthalmic disorders, diarrhea, severe growth retardation, delayed sexual maturation, neuropsychiatric manifestation and frequent infections are common in acrodermatitis enteropathica. This is an impact of acrodermatitis enteropathica in infants, and you can see the lesions typically symmetric in the buttocks and also in the cheeks. It is a common impact of acrodermatitis enteropathica, a common zinc deficiency disorder. This is a picture which depicts both toxicity and zinc deficiency. Let's see about zinc deficiency. Zinc deficiency in brain leads to decreased nerve conduction, neuropsychiatric disorders, neurosensory disorders, and mental lethargy. In thymus, it leads to atrophy of thymic gland. Skin lesions, decreased wound healing, and acrodermatitis are common symptoms in skin. Reproductive system is also impaired due to zinc deficiency. It leads to infertility, retarded genital development, and hypogonadism. Coming to toxicity of zinc, it leads to lethargy and focal neuronal deficits. In the respiratory tract, zinc toxicity will lead to respiratory disorder after inhalation of zinc smoke, metal fume, fever. Gastrointestinal tract shows some impact due to zinc toxicity, nausea, vomiting, epigastric pain, and diarrhea. Prostate gland shows increased risk of cancer due to zinc toxicity. Zinc toxicity is mainly due to inhalation of zinc oxide fumes or sometimes due to rat poison containing zinc compounds. Symptoms of zinc toxicity include ulcer, pancreatitis, anemia, vomiting, pulmonary fibrosis. Symptoms of severe zinc toxicity are mainly headache, fever, leukocytosis, anemia, platelet aggregation, and phagocytosis. So, thank you for patient listening.